Hello friends, today we'll be discussing about stapler devices and along with that we will discuss about some alternatives to skin suturing and staplers. So let's start. Stapling devices in surgery. Before starting, I would like to thank Chandana Shri Ma'am for sharing the wonderful notes with us. These notes are very helpful and useful for quick revision. The link for the notes is given in the description. You can download it from there. So without further delay, let's get started. So staplers are surgical instruments or machines that help and permit facilitate surgical procedure like resection, transaction, anastomosis. So resection, transaction and anastomosis. So you cut and join in rapid, accurate and reproducible fashion. Quick, perfect and similar to others in the reproducible fashion. So what are the types we have? That is skin stapler, laparoscopic hernia mesh tackers, open hernia mesh staplers, ligating clips or clip applicators, vascular staplers and GI anastomosis stapler. Now you'll be seeing about GI anastomosis staplers in detail. So GI tissue is biphasic, so it has both liquid and solid component at different ratios. So it is seen that proper compression of the tissue is necessary before application of the stapler in order to obtain good results. So we have to consider these two things, that is proper compression of the tissue before firing the stapler to have good results. So there will be less leak, good hemostasis and decreased contraction or stricture. So we have to apply it, keep it for some time, that is around 15 to 20 seconds, then compress it, again keep it for 15 to 20 seconds and fire it, and then keep it for 15 to 20 seconds before removing. So we have, what are the types of GI staplers? So linear staplers. So these are linear non-cutting staplers or linear cutting stapler. In linear non-cutting stapler, we have stapler which gives a double jagged row of staples, triple in case of vascular stapler. So you can see the two lines of staplers and it is used for closing the hollow viscous free end of the bowel and ligation of the large vessel. The length available are 30, 55, 60 and 90, where 30 is used for vascular cases. In linear cutting, we have delivered two rows of double staggered row of stapler, two double row staggered row of staplers, that and there's a division in between these two rows. So the tissue is divided in between. So you can see in the diagram that there are four stapler lines and there is a division in between the two stapler lines. So here there is transaction and closure of the tubular structure, and it is useful to create side to side anastomosis. Length available is 55, 75, 100 mm, and as per the staple height, closed staple height and color and use, we can discuss. If it is white, the staple height is 1 mm, useful for mesentery and vessels. In blue it is 1.5 mm, useful for small intestine. Gold is 1.8 mm, it is thicker and for thicker intestine. Green is 2, that is used for stomach. Black is 2.3, used for very thick tissue. Now we see circular stapler. It is useful for create end-to-end anastomosis, EEA, with intraluminal deployment. So here in the machine we have head anvil which is secured in the first part of the bowel segment with purse string suture, and the other part is the stapling device or the body which is through the second bowel segment, and the anvil and the stapler body are engaged and the stapler is deployed. To check the correct process of anastomosis, we see for a donut of tissue which is resected containing parts of both the bowel segments, the proximal and the distal part, and the two ends are anastomosed by a row of double staggered staplers. So as you can see in the diagram, so this is the cut line and there is a two row of staplers. So it creates an inverted end-to-end anastomosis and is useful for esophagogastrostomy, esophagoenterostomy, gastroenterostomy, and coloproctostomy. It is also useful for stapler hemorrhoidectomy. So you have to consider that the contour that the stapler limb is curved sometimes to follow the sacral hollow used for low anterior resection. So it will be like this shape. So it will be slightly curved. Now we see the transverse anastomosis staplers, that is TA staplers, which provide two rows of stapler for a single anastomosis, useful for sealing enterostomy, creating gastric tubes and gastric partition, sometimes also known as thoracoabdominal stapler. Endo-GI staplers are also available for lap and robotic surgery. Now considering the stapler procedure principles. So first we check the instrument and familiarize ourselves so we know how it works and mechanism of its work, and load the stapler properly. Following the standard surgical procedure principles, that is, we determine the viability of tissue to be stapled. If it is fine, rule out any other distal obstruction to avoid further issues. To avoid tension in the stapler line is very important because it will create ischemia. Later, precise tissue dissection to incorporate extra tissue. To avoid incorporating extra tissue, that is, if that comes into the staple line can become weak. Avoid adequate compression to ensure hemostasis and prevent leakage. So you have to compress enough so as to give proper stapler line and provide and prevent further leakage. Avoid excessive compression to create unnecessary tissue damage. After assembling the stapler and tissue, we allow for 15 seconds as we have discussed before firing, ensuring that there is no extra tissue in the firing line because that will create disturbances later and create a weak anastomosis. Fire the stapler line in a smooth movement without stopping and check the staple line for integrity. And also if we can bury the staple line by oversewing by seromuscular suturing if needed. So this was all about staplering principle. Now I'll be seeing some things about newer alternatives to sutures. So for that I have taken help of few internet articles and Love and Bailey. So let's start with this. That is, we have skin adhesive strips. These are indicated in low tension wounds and areas with minimal moisture. For example, the wide excision of breast lump, and it has facility of scar minimization, so there is very little scar. So now the types we have for this is self-adhesive tapes, that is steri strips, or adhesive polyurethane films like the Opsite, Tegaderm and Bioclose. Benefits is it has secure wound closure, reduce scarring. It also allows wound inspection during the wound healing and protects against infection. To consideration, or we have to consider about contraindication, not suitable for high tension wounds, so contraindicated in that, and it may be affected by excessive moisture, so we have to be careful where areas with have high moisture like the groins axilla. Next is the tissue glue. So in tissue glue we have cyanoacrylate based tissue glue. The composition is N-butyl 2 cyanoacrylate polymer, and the mechanism is it polymerizes upon application to the tissue to form a strong adhesive bond, and we need the area of suturing or closing should be clean, dry, and have excellent hemostasis and no tension. So these are the requirement. Indication is rapid closure of laceration, especially in children, avoiding local anesthetics and suture. Advantages: quick application, no delay in wound healing, low infection rate, and disadvantage being it is slightly expensive. So some detail about the cyanoacrylate glue. So it on quick polymerization when coming in contact with moisture, it provides good closure and has excellent tensile strength for wound closure, and it is water resistant, so it can be also used in moist environment. Wide range of application like skin, mucosa and visceral tissue. Minimal tissue reaction, generally well tolerated with low incidence of inflammation and allergic tissue. So it has minimal reaction, and it can also help in clot formation and reducing bleeding. And it is cost effective, not very expensive as compared to suture staplers. Limitation, it can be brittle sometimes and susceptible to dehiscence in high tension area, and then removal may be difficult. Indication, small laceration, surgical incision and skin grafts. Contraindication for these is active bleeding, infected wound and mucosal surfaces requiring prolonged closure. Now something about the chemical nature of these glues, that is acrylic esters. These are acrylic esters. And cyanoacrylates are derived from the acrylic acid, especially esterified with the cyanoacetic acid. So acrylic acid is esterified with cyanoacetic acid, and these are in the monomer form, as you have seen, with low viscosity and colorless liquid form. They rapidly polymerize with moisture or alkaline surfaces to polymerize and form solid polymer, and they have a polymeric structure on coming together, and they have common esters in the form of methyl, ethyl or butyl cyanoacrylate. They are initiated by anionic polymerization, that is base catalyzed reaction, and they have exothermic reaction. They generate heats and result in rapid setting and form a strong adhesive bond with the surface it attaches. Now the fibrin tissue glue. So here we have fibrinogen converted to fibrin by thrombin and cross-linked by factor 13 with aprotonin to stabilize the fibrin network. So this is the composition. Mechanism, it uses a natural clotting process for adhesion. Indication for these fibrin-based tissue glue is hemostasis in liver, spleen injuries, dural tears in neurosurgery, ENT ophthalmic surgery, skin graft attachment, prevention of fluid collection under the flaps. So these are some of these uses. Good adhesive properties and versatile application. These are the advantages. Limitation is ineffective for brisk GI bleeding. Now we see some others like adhesive sealant, which are platelet rich fibrin, which are autologous sealant with growth factors, and they also promote wound healing. Then we have synthetic bioadhesive, which are tailored property for specific wound. Then tissue adhesives, which are designed to mimic natural tissue adhesion and strong and flexible closure. Then we have biodegradable staplers and clips, that is absorbable staplers made of polymers, eliminating removal, biocompatible material, and these staplers have minimum tissue reaction, improved design for better tissue approximation and security. Now considering regenerative and bioactive materials, that is collagen based matrices, which provide structural support and promote tissue integration, and decellularized extracellular matrices, which mimic native tissue environment and facilitate tissue repair and cellular infiltration. Growth factors and delivery system, growth factor delivery system, which incorporate growth factors to accelerate healing and reduce scar formation. Stem cell laden scaffold, which promote tissue regeneration and functional recovery. Now some not wound closure devices, special ones like the knotless suture, which has simplified application and reduced tissue trauma, like the barbed sutures, which has enhanced tissue grip and reduced slippage. Self-retaining sutures, which maintain tissue approximation without continuous tension. Then automated closure devices, which increase speed and precision of wound closure. Some advanced wound management techniques like the negative pressure wound therapy, which accelerate wound healing by removing the exudate and promote granulation tissue. Hyperbaric oxygen therapy, which provides oxygen, improves oxygen at the wound and improves wound healing in specific conditions. Then electrical stimulation, which is some new advances, which modulates cellular activity and promotes tissue healing and regeneration. Ultrasound therapy, which enhances blood flow and accelerates wound healing. We have to consider some special points for selection, that how is the wound type and location, patient factors like the age, comorbidity, infection risk, and presence of any other infections, cosmetic outcome as per the patient psychology, cost effectiveness. Now some of the future trends, that is smart sutures, which incorporate sensors and drug delivering capability for real time monitoring and controlled release of drugs. 3D printed scaffolds, which are tailored for specific wound effects and improve tissue regeneration. Artificial intelligence assisting in wound assessment and closure planning and outcome prediction. Combination therapies by integrating multiple closure method for optimal results. So this was all about recent advances or alternatives to suture. Hope it has been well understood. So thank you for watching. Please like, share and subscribe, and keep studying, keep growing, and never give up, because great things take time. Thank you. See you in next video soon.